Hi, good afternoon, everyone, and welcome to our live broadcast here at Doral Health and Wellness. My name is Christina, and we're so thrilled to have you join us here today. We have a very important topic to discuss with you on cervical cancer screening. We are honored to have Dr. Ziyad Mansur join us today on this great topic. Dr. Mansur is a renowned expert in women's health, and he will guide us through the latest insights on cervical cancer screening. It is extremely important that you know how to how you stay healthy. Dr. Mansur, just to give you a little bit background on Dr. Mansur, he's a very well seasoned obstetrics and gynecologist specialist. He's based out of New York. He has over 46 years of experience in this field. So we're so honored to really have him join us. He earned his medical degree from American University of Beirut Facility of Medicine and currently serves as the chief of the Gynecology Department here at Doral Health and Wellness. Dr. Mansur, thank you so much for joining us. I will give over the microphone to Dr. Mansur so we can get his great insights.
Hello, everyone, and Christina, thank you very much for your kind words and nice introduction. So, our topic today will be cervical screening and management of abnormalities. Okay, next slide. Where do we have to do the next slide? They were? Okay. So, let me give a small introduction before we start the formal presentation. CA of the cervix or cancer of the cervix is one of the very common cancers in women, and if it is detected early, it will be treated and cured without any consequences. However, very important point is that 25% of the total population of the United States go unscreened, and every year 100,000 women are managed for pre-cancer stage of the cervix, which means it's abnormality of the cervix, but it has not extended into cancer. As we know, cervix might be normal on one side, and on the other extreme, cancer of the cervix. In between, there are stages that progress from normal to cancer. Cancer of the cervix does not jump overnight from normal to cancer. It takes years. So this is why I emphasize the importance of screening and periodic examination, so that if there's any abnormality in the cervix, it could be addressed and treated before it progresses. Every year, there are 14,000 women who are diagnosed with cervical cancer. 4,000 of those die every year. So imagine every day there are around 12 women that die from cervical cancer. Okay, to the presentation. So when do we start screening? We start screening at the age of 21, not before, because cancer is not known to happen before the age of 21. If the pap smear is normal, then it should be tested between 2 to 3 years between the ages of 21 to 29. Between the age of 30 to 65, pap smear will be tested every 3 years. Now, what is the pap smear? Pap smear is a diagnostic tool where, when a patient is undergoing a gynecological examination, we take sample cells from the cervix, which is the opening of the neck of the uterus. The uterus has two parts. It has the body of the uterus, where menstruation comes from and where the pregnancy occurs. And then there is the cervix, which is the opening of the neck or the canal of the uterus. The Cervix is very important to be checked because that's where the cancer occurs, and it occurs because there are virus viruses that can cause the cancer. It's called HPV, which is an acronym for human papilloma virus. It's a kind of virus where around 80 to 90% of population have it. Most of the time they have no symptoms, but when the virus attacks the cervix, in the process when the cells are changing, it can go inside the inside the cells and cause changes that later on can become cancer. Now there are at least 450 types of human papillomavirus types, but only like 30 or 35 of those can cause cancer, and 65%, that's two-thirds of cancer of the cervix, occur due to uh, subtype 16, which we call HPV 16. It's called high risk HPV DNA. Also, subtype 18 is important. At the age of 65, pap smear should not be done unless a patient had history of cancer before or was treated for any abnormalities. Then pap smear has to be done every 2 to 3 years, depending on the findings. But in normal population with no abnormalities, pap smear should stop at 65 because there is no cancer after that. As I mentioned, the cause of cancer is the virus, which comes into the body and uh, cause cancer. It also can cause cancer in the anogenital area. It can cause cancer in the oropharyngeal, that's in the mouth and in the throat. Most of the time, the virus is silent. What do we mean by silent? It means that it does not produce any symptoms. So a patient can have the virus and not know that they have. In few occasions, it can cause what we call warts, venereal warts. These are genital warts, which are overgrowth of cells on the outside of the vagina that at that stage could be transmitted to another person through physical contact. Some of the factors that increase the chance of cancer: smoking. Smoking, especially nicotine, because it will decrease the immunity. And if the immunity decreases, then any virus which normally would not attack a healthy individual will have the opportunity to attack those cells and cause changes that can lead to cancer. Some studies have shown that long-term use of oral contraceptives, that's birth control pills, may lead to increase, but we have not seen it very often. Other factors: childbirth, the process of bearing children and delivering can increase the chance of cancer, but it is a very minor factor. Next. Okay. As we know that the human body is controlled mainly by hormones. Hormones are very essential products of different organs. In the female population, there are hormones that are secreted from the brain, especially the pituitary gland. They are called FSH, LH, and prolactin, which are responsible for producing ovulation. They are responsible for producing menstruation and for lactation during after delivery. These hormones have direct effect through the blood on the ovaries, and they can cause the ovaries to produce the eggs and then subsequent pregnancy. So hormones are extremely important for both the physical and the emotional well-being of women or people in general. So achieving a normal balance of hormones is extremely important. And as we say, sound mind is a sound body, and the sound body is a sound mind, which means if we lead a healthy life, with healthy food, with exercise, with mental well being, all those factors can boost and increase the immunity of people. And as such, it can delay or even prevent development of cancer. And in many studies, even patients who had cancer, who had what we call holistic medicine, which is basically emphasizing well-being, exercise, good diet, rest, uh, mental well-being, come cancer. Okay, next. As I said, hormonal imbalance, in addition to causing um, multiple problems, they can have mood disorders, especially estrogen and progesterone, which are produced by the ovaries during a cycle. They can contribute to anxiety, depression, mood swings, changes in body weight. It can cause to weight gain. And as we know, weight gain in obesity and overweight, it can lead to other metabolic diseases like diabetes, thyroid imbalance, and those factors can affect the body, the metabolism. It can have a bad influence and a bad effect on bones, on joints, on a whole well-being. Also, any kind of hormonal imbalance could lead to irregularities in the menses and menstruation. So instead of having menses every month on a regular basis, hormonal imbalance can cause irregular bleeding, bleeding in between periods. It can cause heavy bleeding. It can cause severe pain, what we call dysmenorrhea, which is severe menstrual cramping, and it can affect sexual desire. It can affect the ability to have children. And as we said, it can also cause changes in the cervix, which we call dysplasia, that can lead to cancer if it is not addressed early and managed. So, how do you achieve hormonal balance? As I said before, hormonal balance is extremely important, not only to prevent or decrease the risk of cervical cancer, but hormonal balance is very crucial to the total well-being of uh, human beings. So some of the factors, as I mentioned before, is healthy diet. Usually I tell my patients, when you go to the supermarket, just go on the periphery, don't go in between the aisles, because good products come in no boxes or cans. So if you go around the aisles, you can get the healthy food. If you go in between aisles, that's where all the chemicals occur, and they have a very detrimental effect on the body. So healthy diet. Uh, Previously, people used to be afraid of fat, and they say, "Oh, we cannot eat fat." But one third of each person's diet has to be fat. Instead of eating margarine, get butter and oil. Olive oil is the best oil that has been proven for health. Avoid other oils like canola, corn. These are bad oils. Fresh produce, vegetables and fruits, they have very strong antioxidant properties, and many of them can boost the immunity. And immunity, you have to think of it as the army that protects a country. If you have strong immunity, it can fight viruses, it can fight cancer, it can lead to the well-being. And the fruits and vegetables are important because they can also uh, promote well-being, and they can promote the production of normal hormones. Exercise is very important. However, you don't have to go to the gym every day to exercise. Any routine that is done on a daily basis is very important. Cleaning the house, doing the laundry, walking, going to the supermarket. Instead of driving, you can walk. All these on a daily basis. Taking the staircase instead of using the elevator for one or two flights. Regular routines that can be done every day are very important to the cardiovascular. They are very important for the muscle development, and most importantly, are they are important for the bones and development of calcium and deposition of calcium in the bones. Also, regular exercise, regular routines can lead to body flexibility and not being stiff. And those are very important, because then as people get older, the joints become very stiff. But if routine habits are done through young age and continue through older age, that can lead to healthy body and healthy habits. Another important factor is stress. Stress is one of the bad influences in one's life. When there is stress, there is increase in the level of cortisol, and cortisol is a very bad hormone. So if you avoid stress, other hormones can be elevated, which can secure happiness. Those hormones are produced from the central nervous system, and they are called serotonin, tryptophan. They can cause happiness, and they can decrease anxiety and distress. So praying, meditation, yoga, deep breathing, slow breathing, quiet places, all those factors are important for the well-being, and they are important to manage stress. And all those factors will lead to a healthier hormonal level. Okay, how can we avoid um, cancer or prevent cancer? Many years ago, a vaccine was developed, which is important against human papilloma virus. The recommendation is to be given to children ages 6 to 12, male and female, because human papilloma virus not only affects female population, it can also affect male population, because it can lead to cancer in the in the penis. It can cause oral cancer in the throat, in the larynx, and it can also cause cancer in the anal area. So male and female, it's important to vaccinate them between the age of 6 and 12. And usually they are given initial dose of vaccine, and then another dose in 6 to 9 months. After the age of 12, between the age of 13 and 25, the recommendation is to give 3 doses of the vaccine. And the vaccine is a combination of different strands of the virus HPV 16 and 18. Okay, now, how can we prevent cancer of the cervix? We can prevent cancer of the cervix by vaccination, by safe sex practice, by having regular checkup at the gynecologist, and by checking at any time if anybody notices anything unusual in the genital area. Now, empowerment and self care in female health are very essential for the female health, especially in cervical cancer prevention. And as I mentioned, understanding the impact of hormones, understanding the impact of healthy living, of exercise, of awareness, prevention, regular screening, all those will be very important to prevent cancer and to treat any abnormality if it is found early. Vaccination reduces the risk of cancer, however, it does not prevent it completely. It's preventative between 80 to 90%. That was a brief presentation about the cervix, and I cannot stress enough the importance of screening on regular basis and going to your doctor to have the pap smear done and the HPV testing. Thank you, and you all have a good day.